Welcome to part 2 of evidence-based practice, documentation, communication, and teaching. This part is going to focus on communication. So what exactly is communication? Well, communication is the act of giving, receiving, and sharing information. Communication occurs between person to person and does not have to be face-to-face. Communication occurs when someone initiates and sends a message. The person receiving the message translates it, interprets the message being received, and confirms that the message has been received. This sounds like a very easy process, doesn't it? Unfortunately, there's so much more that goes into actually communication. There are 4 ways that nurses communicate: verbally, non-verbally, written, and visually. Verbal communication uses voice to send a message, and the translation of that message really depends on the understanding of the language. Nonverbal communication involves all the physical ways we speak. We use our facial expressions, gestures, eye contact, touch, our position, our posture, and our gait, and the non-word sounds that we make, and even our physical appearance. Written communication comes in the forms of our documentation, emails, text, the whiteboard in a patient's room, and even our social media presence. In addition to how we communicate, there are factors that affect communication. We have the developmental level of both people involved in the communication. We have the social cultural differences, the physical, the mental, and the emotional state, the values and beliefs, the physical environment, and even the roles and responsibilities of the people involved. All of these factors can positively or negatively affect how we communicate. We're going to have an entire PowerPoint dedicated to documentation, so I'm not going to discuss any documentations right now. However, I do want to mention the other common written communication techniques in nursing. The first is social media. Did you know that everything you put on social media can be used against you? Social media is so detrimental to communication that the ANA, NCSBN, and even your employers have guidelines for nurses' use of social media. Never post anything about your job or your patients on social media, even if you're set to private. I guarantee you it'll get back to the higher powers and it will be used against you. Posting about patients on social media can be a HIPAA violation, and that is not something you need. When it comes to emails and text messages, it can be a little tricky. Some facilities allow and encourage the use of email and text messaging for patient care. Usually they have security measures in place and they have technology that requires you to communicate this way. Most will not allow you to email from your personal email or text from your personal phone. This is to protect patients' private information and to not violate HIPAA. It's very important for you to follow your facility's policies and procedures related to written communication and to not violate anything, as there's a risk every time you communicate this way. So why is communication so important in nursing and in healthcare in general? Well, communication helps us collect our assessment data. A lot of our head to toe assessment is asking questions. That's the interview part of our assessment. Communication is going to help us set our goals and our interventions with our patient. Communication is going to help us evaluate our interventions and our goals. Communication helps us initiate needed changes with our patients and our healthcare team. Communication also keeps us safe from legal issues. And lastly, it helps us work as a team. We cannot function as nurses without our team, and that team has to communicate. So what can happen if we don't communicate? Well, we can hurt our patients. We can hurt ourselves physically, mentally, and emotionally. We can hurt our team members. We can have legal repercussions, especially if our lack of communication hurts somebody. And lastly, we could kill our patients. Communication errors cause 60 to 70% of all preventable hospital deaths. Also, miscommunication causes 80% of serious medical errors. Those statistics are staggering. If the airline industry had this rate of errors, one plane per day would crash every day in America. After studying safe industries like the airline industry, healthcare decided to adopt measures to improve our communication. Some of these are verbal, like using SBAR communication when we speak to providers and other healthcare workers. Some of it is written, like DAR notes and our EMR documentation. Some of it was changing how we receive verbal orders, and then there are many other random ways people have tried to improve communication. Since we have a section related to EMR and documentation, I'm not going to talk about EMR in this PowerPoint. Let's start with discussing SBAR, also called ISBARR. SBAR communication is a way to speak to others in healthcare to get your point across quickly and effectively while not missing key information. It helps to eliminate rambling and fluff that isn't needed. We can use SBAR to give report to another nurse or to call a provider. Each letter of SBAR has its own meaning. The S stands for situation, the B stands for background. Both of these sections are used to quickly identify the reason for communication and what the pertinent background information is to the person you're speaking to that requires this information. The A is for assessment. This is when you give that person details of the assessment you performed. The R is recommendation. This is when you tell the person what you need or what needs to be done. This section will look differently depending on who you're calling and who you're speaking to and why. Calling a provider is going to sound differently than giving shift change report to another nurse. When we call a provider with any issues to discuss, we use the ISBARR format. It's the exact same thing as SBAR, we just added some letters. The first thing we're going to do is identify yourself. Where are you calling from and who are you calling about? For the S, the situation, you're going to tell the provider what the problem or reason is for your contact. Providers do not have a lot of time, so you want to grab their attention quickly by telling them why you need them. Then you're going to be giving them the B, the background information they need to know about the patient. When the patient is admitted, why they were admitted, allergies, code status if needed, and any previous significant medical history. Make sure you're telling them relevant information. They do not need to know that an 89-year-old patient who's there with chest pain had an appendectomy when they were 6 years old. Next, you're going to tell them the A, the assessment information that is pertinent to the situation. This could be vital signs, lab results, abnormal assessment findings, and if you have an idea of what's going on, you can mention that as well. Nurses are smart. We can figure out what's going on with the patient after a while. The first R is recommendation, telling or asking the provider what you need from them. The second R is when you read back the orders they gave you to make sure you have it correctly. This is not repeat back. You have to write it down. If you're unsure of what the doctor told you, clarify it. Do not guess. One recommendation from experience is have that EMR open when you speak to the provider. Also, know what you're talking about. If it's abnormal lab results, know what the labs are when you're calling them. They don't like having to wait for you to search for things in the chart. SBAR for shift change is going to be a little different. When we give shift change report, we need to give the oncoming nurse as much information as possible. I wrote out on this slide what's required for each section of SBAR shift change. Shift change should leave little question in the oncoming nurse's mind. They should be able to pick up right where you left off, like calling a provider. If you have questions or need to clarify something with the other nurse, do so. You may also want to mention any plans of care in place and what interventions you're going to be doing. Some places you have to actually write down parts of your shift change on something called a Cardex. A Cardex is a paper form that lists out things that have occurred during the admission to the hospital for the nurses to not have to mention every single thing verbally. Cardexes are great for people with long admission stays or who are in the ICU where a lot of things are happening every day. One other thing that hovers in a gray area between documentation and communication are things called nurse-sensitive indicators. These are areas of patient assessment or patient care that nurses must obtain data for and report. Some of this is how many days a patient has had a central line or a Foley catheter in place, because both of these invasive lines can cause an infection. This type of assessment data needs to be documented and communicated to the healthcare team, so that's kind of why it belongs in both places. One last piece of communication that's used a lot in healthcare settings is incident reports. These are written types of communication used to discuss negative events that occurred to a patient. Things like a fall, a medication error, a sentinel event. These are used to determine what caused the issue, how it can be prevented or improved upon, and has some negative connotation with it. No one likes an incident report. Here's the thing, if a facility has a good quality improvement and risk management department, incidents reports won't be used to punish people, they're going to be used to fix the issues. Some of the best departments I've worked in wanted us to put in incident reports for near misses. Their thought process was, if I came close to making a mistake that could have hurt somebody, there is a flawed system in place and it needs to be fixed. So when it comes to writing an incident report, we need to stay very factual and as objective as possible. We keep our emotions out of an incident report. And lastly, we never, ever, ever document in the patient's EMR chart that we made an incident report. Even if a provider tells you to, never, ever. If someone documents that an incident report was created, it opens up a legal hole. It's a massive legal issue. So never document in a patient's chart that an incident report was created. To have effective caring communication with our patients and our healthcare team members, nurses need to be mindful of some key points. First, we're a caring profession. Our whole profession is focused around us being able to be caring with our behaviors and the care that we provide. We're going to make relationships with our patients and their families and our healthcare team, and everything we do is to work to make sure the person in front of us is the center of what we're doing. Nurses must remember that communication is the way we establish rapport and trust with our patients and our healthcare team. This means the way we communicate matters. Communication sets the climate for everyone involved and allows us to move forward towards common goals, or it's going to stop any progress in our tracks. Remember, for the nursing process, goals are determined with the patient's input. So if we're communicating ineffectively, we don't make good goals. The ways that nurses can communicate with a caring disposition include being warm and friendly to those you communicate with. We want to communicate openly and with respect. This does not mean that we have to agree with the person we're communicating with. It just means we're treating them in a way we would want to be treated. We're treating them as a person and not as a task to be completed. We want to show empathy, which means we're able to understand their feelings from their point of view. We want to be honest and trustworthy. Part of that means we provide privacy and confidentiality when needed. We also need to be mindful of any cultural aspects of communication. Some cultures don't make eye contact, but in America, we could see that as the person being rude or hiding something. Touch is also a culturally sensitive communication tactic. Some cultures do not allow any touching during conversations, and some cultures use touch a lot. If you have two people with two different touching beliefs, this could create a non-caring conversation environment. We also want to make sure we listen. Communication goes both ways, so we need to make sure we're actively listening to what's being communicated to us as well. There are many barriers to communication. It's probably easier to communicate ineffectively than it is to be effective because of how many barriers there are. First, we have environmental barriers to communication. These barriers to communication means that something that we see going on around the conversation is affecting the conversation. In healthcare, a lot of this has to do with the high workload we've been seeing. Nurses and healthcare workers have too much to do and not enough time to do it. Some days we don't even have 5 minutes to go pee, let alone have an effective conversation with someone. Sometimes we work in a hospital environment that makes us not want to have a conversation. I'll speak more on this on the next slide. Next, we have personal characteristics of the people in the conversation. We've already discussed culture and how eye contact and touch could have effects on communication, but we also have the judgment being portrayed during the conversation. Remember, we should be empathetic and understanding, not giving judgmental comments or advice that violates the right of the people we're speaking to. We also do not want to go into a conversation with hidden agendas. This could be a winning at all costs mentality, using gossip and rumors, or failing to recognize the person as a human being for some belief that you have. Then we have emotional issues. This can be multifaceted. Some days are bad days and we literally cannot speak because we're so emotionally drained. Those days, I try to tell people that I just cannot think or speak right now, and I'll get back to them when I can. Other times, we're angry, and angry tones and angry body language doesn't help communication. We can have disruptive behaviors like not letting the other person speak or changing the subject because we don't want to speak about it. Lastly, we have poor communication techniques that cause barriers to communication. This could be not listening when someone is speaking and daydreaming instead. It could be not focusing on the person speaking and doing another task instead. Another barrier to communication is the ability to speak or hear properly. This is something that's very important to remember as we care for an aging population. They have vision issues, hearing issues, cognitive issues that all affect the way that they hear and speak. We also have to change our techniques to communicate the best with them, especially once we figure out what's going on with them. If they can't hear, we need to speak louder. If they can't see, we need to help them be able to see. One of the biggest factors towards environments that are not conducive for communication is having a hostile work environment. This can happen for many reasons, but first, let's discuss employees making the environment hostile. The first thing we have in healthcare is incivility. This can be nurse to nurse or healthcare worker to healthcare worker. Incivility is when people are acting rude and hostile towards each other. Part of this stems from nurses eating their young mentality among the older generation of nurses, and part of it stems from being stressed out all the time at work. Older nurses feel that it's acceptable to treat newer nurses, that they're beneath them because that's how they were treated. This behavior is terrible and it needs to stop. This behavior starts in nursing schools, and if the professors don't change how they behave, the students will think it's okay when they become senior nurses. The next factor that makes work environments hostile is workplace violence. Workplace violence is any violent acts, including physical assaults and threats of assault, directly towards a person at work on duty. This can be verbal harassing, threatening, yelling, bullying, and hostile sarcasm. Unfortunately, our society has grown to think that acting this manner is acceptable, and workplace violence has increased everywhere in every profession. If you encounter this type of behavior, remember it is not acceptable and you do not deserve to be treated like this. And this is the end of our presentation on communication.